Hello, everyone. Welcome to our webinar on our 2021 system numbers. Thanks for joining us tonight. I'm happy to see so many people logging in. We had a lot of folks register tonight, so thanks for joining us. Again, this is our webinar about our 2021 homeless system numbers, and I am Laura Ellsworth, Strategic Partnerships and Advocacy Manager with Council for the Homeless. My pronouns are she, her, hers. And I'd also like to introduce my colleague Dale Whitley, HMIS Director for Council for the Homeless. Dale is the person who manages the Homeless Management Information Database and supports other system providers in their use of the system. In fact, 33 local provider agencies with more than 200 individual users input their homeless services data into the HMIS database. Dale's work is a tremendous part of what we will be discussing here tonight. And Dale is also going to be helping to monitor our chat tonight and will be helping me out by sharing some links and helping to make sure that we keep up with the Q&A. So I see a lot of new folks here tonight, and I do have a few reminders as we get started. The only people that you will see and hear are us panelists tonight here. So don't worry, you're not on camera. You can post any questions that you have in the chat, like I mentioned, and also we will be recording this webinar and sharing it out afterwards on our website, which you can view anytime. And also at the end of our webinar tonight, we're going to have a survey. And I want to do a quick plug for our Homeless Action Plan survey. That's going to show up in your browser at the conclusion of tonight's webinar. And I'll also be including it in the email along with some other links after our webinar tonight. So please do take that survey. We really do appreciate your input. And your input about the webinar really does help us plan our next webinars. So thank you for doing that. So tonight we're lucky to be joined by some incredible program directors on our staff. I'm going to start us off tonight with some broad observations about what the system data tells us about homelessness in Clark County in 2021. And based on the data, some good news and some bad news, the general overall purpose of the homeless crisis response system. And I'm going to share some stories about folks we've gotten to know this year. And as we dive into the numbers tonight, I do just want to remind everyone that each data point in the reports that you'll be looking at represent a person, a family, a child, teen, or senior living with the instability of life without a safe and stable home. So let's get started. Dale, can you post a link to our 2021 system numbers in the chat for folks? You can take a look at this and feel free to refer back to this as we go along tonight, or take a look at it anytime on our website. So I also want to just start us off by saying that our focus tonight is on our annual system numbers, which is a full year of data. The annual system level data drives the goals and the outcomes in the Clark County Homeless Action Plan. And oftentimes people get confused about the point in time count and the annual system numbers, and that's totally understandable. But the point in time count is different, and it's exactly what it says. It's data from a specific day, a specific point in time that is done each year and is required by HUD and the Department of Commerce. It's a way to get a finger on the pulse of the community on one day with the best available data on that day in that moment. And because it's normally done around the same time each year in the same conditions, at least pre-pandemic, it's good for determining trends and capturing data and helping to identify people who are out there and just bring them into the system. But I do want to be very clear that tonight, what we are talking about is the entire calendar year of 2021, and it encompasses every household who contacted the housing hotline, which is the coordinated entry point into the homeless crisis response system. So if you're curious, you can also view the point in time count data, which took place on February 24th of 2022 on our website also. So Dale is going to post the link for the point in time count as well in the chat for folks who want to take a look at that. So we'll also share that out. So don't feel like you have to do that right now. You don't have to look at it right now. You can just copy the link and save it for later. It'll be on our website. You can take a look at it, whenever you'd like. And it can be found on our website under the About Homelessness tab. So let's get started with some good news for 2021. There was an 8% decrease in the number of people new to homelessness in 2021 as compared to 2020. And it shows the effectiveness of the massive federal and state efforts to keep people from falling into homelessness during the pandemic. An influx of federal funding to pay arrears and future rent for households impacted by COVID-19 resulted in just over 30 million in rent assistance, paying for 27,000 months of rent for 3,860 households. And it appears that this intervention, in combination with the eviction moratoria, prevented the anticipated wave of homelessness as the realities of the pandemic started to sink in early 2020. I also want to point out that more than 650 households were housed through diversion, which is coaching and one-time financial support, and through one of the 38 housing programs in Clark County. And almost 1,200 households were sheltered in 2021. And the bad news is that the number of people who are able to self-resolve their homelessness without the assistance of a homeless crisis response system program is decreasing, resulting in the number of people experiencing homelessness at any given time to rise. The combination of low vacancy rates, rising rents, lower apartment turnover during the pandemic, and a pandemic response that largely focused on keeping people housed rather than helping them exit their homelessness are all potential contributing factors. And if not for the 8% decrease in newly homeless households, the overall increase in homelessness would have been much larger. We also have need that far outweighs supply. So even though more than 650 households were housed, more than 3,000 were assessed for housing, and only 1,100 households received shelter out of the almost 1,500 that requested it. So please just keep this data in mind when people around you start asking, or opining that people choose to be homeless. The fact is that people experiencing homelessness in our community have very likely asked for help and just haven't received it. The stories you'll hear tonight illustrate the various challenges and resources that each person or family brings to their situation. And as we're talking about the 2021 system numbers for the homeless crisis response system, I want to emphasize the words crisis response. Think of homelessness as a sink that is filling with water. The water in the sink represents people who are already experiencing homelessness, and the faucet flow represents the number and rate of people newly or repeatedly falling into homelessness. The drain represents how many people are exiting homelessness, and the homeless crisis response system's role is to address the water in the sink and try to slow the flow of water coming in, all the while simultaneously keeping the drain clear so that people can resolve their homelessness as quickly as possible. Unfortunately, the system cannot control things that contribute to a faster stream of people or water falling into homelessness. Things like skyrocketing rent, minuscule vacancy rates, global pandemics that require social distancing and closures, and unemployment and underemployment, and many other things. So I'd like to tell you about Victor and Anita. Victor and Anita reached out to Council for the Homeless for assistance with the support of a leader in the Chuukese community. Victor had been working at his warehouse job when he contracted COVID-19. The entire family had to quarantine for 2 weeks, which also stopped their income stream because, as you can imagine, not all workers have paid sick leave. After 2 weeks, while Anita was ready to start working again, Victor continued to experience long-haul COVID symptoms, including overwhelming fatigue that made work at his job impossible. So staff worked with Victor and Anita to gather the necessary documents for rental assistance and assisted in getting them information on how to get food stamps set up. And when the family expressed interest in accessing a COVID-19 vaccine clinic, staff worked to find a location and ensured that the family had transportation. Anita is back at work, and not long after getting his second vaccine, Victor was also able to start back at work. And this is an example of a household that needed relatively little assistance, and things like payment of rental arrears and some connections to some other supportive services, including food and transportation. This household was able to avoid homelessness and stabilize in their housing once again. And an added benefit of going through the homeless crisis response system, the household now has an increased knowledge of community resources to reduce their bills each month. And lastly, the household is also aware of their rights as a tenant and knows where to seek support if needed. And now I'd like to tell you about Julie. Julie is a 77-year-old woman with dementia who lived outside in a tent in between numerous short stays in a shelter. She had been vehemently unwilling to engage and place trust with any services or providers, which is a very common obstacle the homeless system outreach workers face when doing their work. And in fact, it takes an average of 17 positive interactions with a person who is chronically homeless to get them fully engaged and successfully housed. And during this time, staff from Council for the Homeless, Community Services Northwest, the City of Vancouver's Heart Team, and SHARE collaborated to slowly and effectively build trust with Julie. And this partnership effort across nonprofit agencies in the city is just one of the many examples of how the crisis response system works collaboratively in partnership to serve people and meet their needs where they are at any moment. And those needs can change daily, if not hourly. And once that trust was built, and importantly, a unit was available, she was placed in a permanent supportive housing program where an apartment was provided, and she continues to receive intensive supports. Julie remains stable months later and is finally open to seeking regular physical health support. And I want to point out that, her intensive supports include, helping her maintain her medication schedule and proper storage of that medication, bathing, toileting, food, social connections. These supports will be ongoing and permanent. And Julie is housed. She is no longer outside. She's no longer a public concern, and she does not have to move from this apartment. So as you can see with these two stories, homelessness is a continuum of need and solutions that range, and the solutions range upon that continuum. Some people need a relatively small amount of help due to an emergency health situation, for example. Others may need help for the rest of their lives, and literally everything in between. Serving people along this continuum with the support specific to their situation is determined by doing something called a housing assessment. The housing assessment helps determine what each individual's circumstance, challenges, strengths, and needs for stabilization is. And it's what we mean when we say we are meeting people where they are. So first up tonight, I'd like to introduce you to Shavana McEwen, Council for the Homeless Equity and Advocacy Director. Shavana is here to talk about why racial equity needs to be at the center of the homeless crisis response system, because members of the Black, Indigenous, and people of color community in Clark County are most impacted by homelessness. There are many systems that impact who experiences homelessness and how complicated their situations become. I'll turn it over to Shavana now to talk about some of the 2021 system data and highlights and successes, and also opportunities to improve outcomes for Clark County's BIPOC community. Shavana?
Great, thank you so much, Laura, and good evening to everybody. It may come as no surprise to some of our viewers tonight to know that since 2020, Council for the Homeless has made a concerted effort to center our work to end homelessness in Clark County around the historic and current racial injustices and systemic barriers that exist for people of color in our community. What folks might not know, though, is the why behind this intention. So I'm not going to go into an exhaustive history of racial discrimination or housing injustices, but I do just want to share a few brief facts that highlight our reasoning. In 1492, experts estimate that roughly 60 million Indigenous peoples called this continent home today. The number of people who identify as Indigenous or Native American today is roughly 4 million, or only 1.3% of the population of the United States. As early as 1818, people who were not enslaved were legally barred from buying property in a number of states. Immigration policies between the 1870s and the 1920s led to massive wealth inequalities between white Americans and immigrants from Asia, Mexico, and Southern Europe. And redlining was a practice that was popularized and widely adopted by municipalities across the nation beginning in the early 1900s, effectively insulating white communities from people of color and directing city planning dollars, public education funding, and other vital community development resources to white neighborhoods and away from Black, Brown, and Indigenous communities. In 1944, the GI Bill of Rights was passed. The GI Bill of Rights is the single most significant, most influential federal policy in creating what we consider today to be the middle class, and creating an opportunity for families to develop generational wealth and income. And it was written and implemented in a way that restricted Black and Brown service members from across the country being able to access multiple benefits available to them that other communities, that white communities and white service members were able to access. So these are historical examples, and there are many, many, many more historical examples of systems that were built specifically to keep some people out of being able to access things such as housing, wealth, stabilization, or really just common things that we consider today to be basic needs. And so we know that not only locally, but nationally as well, our neighbors of color are experiencing a situation where effectively they have a disadvantage. Some people call it white privilege, other people might call it white advantage. There are advantages, social and economic advantages to being white or in a white community that people of color don't have. And that is also true when it comes to folks who are experiencing homelessness in our community. And that is why we center race and race equity in the work that we do here at Council for the Homeless. On a local level, or on a local area, I just want to point out that there are direct connections between income and what we consider to be housing stability. In Clark County, as well as other parts of the country, Black, Indigenous, and other people of color significantly money than their white neighbors. So I want to talk for just a minute about what it means to be cost burdened. U.S. Housing and Urban Development defines cost burdened as when somebody has to pay more than 1/3 of a household's gross income on housing. The average market rate for a 1-bedroom rental in the city of Vancouver is $1,411, meaning that an individual would need to gross nearly $51,000 a year to afford a 1-bedroom unit. Just for some perspective here, for a person working minimum wage in Clark County, he or she would need to work roughly 73 hours a week to afford that unit. And I want to highlight too, again, recognizing that to afford a 1-bedroom unit in Clark County in the city of Vancouver, an individual would need to gross the $51,000 a year. If you look at this chart here over here on the left, you can see that our communities of color, our neighbors of color, are not grossing that amount of money, not even close for many of them. Go ahead and go to the next slide, please, Laura. Also want to note that in the city of Vancouver, where more than 40% of the county's rental units are located, 51% of households are considered cost burdened. And the overwhelming majority of those homes make less than $50,000 a year. When we look at this, we see that the likelihood of experiencing poverty and the likelihood of experiencing homelessness are absolutely connected, and we know, and it makes a lot of sense, that the more likely one is to experience poverty, especially extreme poverty, the more likely they are to experience homelessness. And once again, the data tells us that people of color, Black, Brown, Latino, Indigenous folks are more likely to be experiencing poverty, to be living in poverty, and therefore more likely to be experiencing homelessness as well. Just as a brief aside, a recent government analysis found that for every $100 increase in the median rental price for a unit led to a 9% increase in homelessness. So the average amount of rent in Clark County has increased in double digits over the last 2 years. And we're seeing, we will be seeing, I believe we will be seeing an increase correlated to that in terms of who in our community is experiencing homelessness. Next slide, please, Laura. So from the report that we're talking about tonight, you can see that 6,285 individuals from 4,000 households were homeless in Clark County at any given point in the last year. And of those 6,285 people, 40% were people of color. Well, how does that relate to the rest of our population? Really, people of color make up approximately only 20% of the general population of Clark County. So there's more than double of what their percentage is in the community are represented in our homeless crisis response system. And so it's quite simply a fact that we are not currently achieving equitable access for people of color in our homeless crisis response system. Next slide, please, Laura. So this is also in the system report that you have access to. And I just want to point out a few things here, some positives and some areas for growth, definitely. So, you know, a moment ago, I mentioned that 40% of people experiencing homelessness are people of color. This graph right here shows that 35% of the households experiencing homelessness in 2021 were households of color. We know here a real positive is that of the 29% of households that were assessed for housing programs, 29% were able to enter into one of those housing programs. And again, I'm speaking specifically about Black, Indigenous, or households of color. So that's really significant, and that says to us that the mode of assessment that we are using is successful, that we're seeing a lot of positives from that. And so just for folks' awareness, a couple years ago, Clark County utilized a very common assessment tool called the VI-SPDAT, the Vulnerability Index. SPDAT, I can never remember what the rest of the acronym stands for, but it's a national tool. It was developed in Canada. It's a national tool that people all across the country use to measure vulnerability. And it's the way that we determine if somebody scores higher, it means that they're more vulnerable. And we want to try to use every last tool in the tool belt to try to get them housed as quickly as possible. What we found, what studies found, was that the VI-SPDAT actually leaned very heavily towards cis hetero white males as being more vulnerable in needing more access to housing than people of color, than women, than folks with disabilities, than members of the LGBTQ community. And so one thing that Clark County did a couple of years ago, Council for the Homeless coordinated a community-wide effort to create a new assessment tool. It's called the Clark County Assessment Tool, or the CCAT. And in order to intentionally try to decrease the disparities in ranking somebody's vulnerability. And so we have seen a really positive outcome from that. And that's something that the community, homeless crisis response system, and Council for the Homeless are continuing to periodically evaluate and assess and work on in order to ensure that we're able to maintain continued success with that. Laura, do you mind going on the next slide, please? I do want to point out, again, just some key takeaways. we do have a lot of work to do in terms of creating equitable access. I don't have I'm sorry, I don't have on the last slide, I did not have the numbers for diversion, and I didn't have the number for rental assistance, but we have seen just a incredible amount of success overall over the last several years for our diversion and rental assistance programs. These are programs that are traditionally or typically more accessible for people of color. I know Sunny's going to talk a little bit more about some of the differences in numbers that we saw in diversion over the last year, but we have seen that those are successful programs. And our rental assistance program, 44% of the families who received rental assistance over the last year identified as being of families of color. And again, I want to link that back to the connection that we see, the relationship that we see between income inequality, and housing stability, or being cost burdened in accessing housing. So we really, it's quite clear that the data and the demographics show us that people of color are, one, more likely to experience poverty at higher rates, two, more likely to be renters and rent at higher rates than white folks, and are more likely to be cost burdened as renters. And so the emphasis on trying to support families of color in that rental assistance program really it's quite clear why we want to do that. And we have been, we feel that 44% really is a significant number of folks that we've been able to help through our rental assistance program. And again, another takeaway, the Clark County assessment tool has shown a positive impact on decreasing those disparities between assessing clients and then housing clients. Laura, next slide, please. So lastly, the thing that I want to point out is that like Laura mentioned, and actually like one of the participants tonight pointed out in the chat right off the bat, there is a lot to systemic racism. There's a long history of social and systemic racism in this country, in our local community, and it's going to take more than just a few years and a few policy changes to make up for that. And so I want to acknowledge a few key partners in the community who are just doing some incredible work. I want to point out Peace Health's Community Needs Assessment, the NAACP's Economic Empowerment Committee, Odyssey World International's Downtown Dignity Program, Swatch's Community Health Worker Program, and LULAC Cares, all of which are examples of community organizations that are either run by and for our local neighbors of color, or are taking an intentional step at putting racial equity at the forefront of the work that they do, and really trying to find out and listen to the communities of color here in Clark County to find out what folks need, and trying to implement changes that will directly benefit those communities. Council for the Homeless is committed to racial equity, to centering racial equity in the work that we do, but addressing the economic disparities are really going to take a community-wide collaboration and effort. So again, a shout out to those partners that are working on that in the community, and I know that there's many more. The last thing that I want to leave you all with is just a heads up that in the next month, you should be seeing a press release and a blog on our post about the 2021 Racial Equity Report that really digs into some of the racial differences that we see specifically here in the homeless crisis response system. Laura, I'm not sure if I took my 8 minutes or if I went over, or if I have more time, but I actually said everything that I wanted to say. So I can kick it back over to you if that's all right.
All right. Yeah, thank you. No, that was wonderful, and we love to hear from you. So it's important, and I'm glad you're here to do that. So next, I would like to introduce you all to Clara Johnson, Council for the Homeless Coordinated Outreach Director. Clara's team serves folks like Jim, who you see quoted here on this slide, people living unsheltered, primarily on the streets or in cars. And near the end of 2021, the last 2 months to be specific, Clark County saw a significant increase in the numbers of street outreach workers across multiple agencies. And that's when the coordinated outreach delivery model began. Thanks to this new outreach effort and a massive increase in staffing and, more people who are living in cars, RVs, and encampments are being identified and connected to essential services, shelter, housing, basic needs, hygiene, and this increase in identification in our homeless crisis response system is really critical to, allocating resources to make inroads in solving unsheltered homelessness. First, we have to identify, and then from there we can assist and resolve. So Clara's here tonight to share some more about the impacts of the creation of the coordinated outreach effort across agencies and the impact of that increase. Again, I know we're talking about 2021. This is the very end of 2021, but we are also, now 6 months through 2022. So just, implications of, this effort going forward as well. So Clara, I'll turn it over to you, and I'm going to stop sharing my screen briefly. So the stage is yours, Clara.
Thank you. Excuse me. Thank you, Laura. Welcome, everyone. Just to follow up on what Laura mentioned about coordinated outreach's expansion, our community went from having 6 outreach staff for the entire county to a team of 30. And that's across 7 different agencies. Included in that 30 are 2 mobile teams that Columbia River Mental Health manages, a mobile medical team, and then we have an evening crisis team. Research has shown that it takes an average of 17 positive interactions with people to build trust and to help them to get on the road to successfully being housed. With our increase in outreach workers, we're able to reach more individuals out that are experiencing homelessness, and we're interacting with folks that don't normally access our services in conventional ways, calling the housing hotline or things like that. Our teams are actually out in the encampments, working with folks and completing assessments, and then working to remove barriers that they may have to getting housed. I just wanted to talk about a couple of myths around homelessness. These are shared on our website, but I wanted to highlight 3 of them. One is that people who are homeless should just get a job and then they would not be homeless. One of the fact is from the National Coalition for the Homeless, they estimate that as many as 40 to 60% of individuals experiencing homelessness nationwide are actually employed. But having a paycheck does not necessarily solve their homelessness or the other challenges that they have to face. The increase of, as we've mentioned, increase in rent, it can take sometimes $3,000 to $5,000 once you add in moving fees and deposits for folks to be able to just get in through the door to get housed. Another myth is that people choose to be homeless. And this myth is dangerous, and it allows us to ignore the trauma of homelessness and the neurobiological effects that trauma has on humans. Being homeless is stressful, it's humiliating, it's exhausting, and it's dangerous. It's a hard day-to-day existence for men, women, and the children in our community. Another myth is that housing should come with conditions like being clean and sober. Evidence tells us that people who are homeless can find stability and healing when provided empowering supports focused on housing and supports. That model is known as Housing First. This approach acknowledges the complexities of addiction, trauma, and challenges that come with experiencing homelessness. It also acknowledges that it can be very difficult to successfully address challenges while living on the streets or in an unsafe and unstable situation. So we first work to, as I said, help our clients remove barriers and get them into housing. And then we're working to connect them to resources that if they do have mental health or substance use issues, that then they're able to be in a safe spot where they can be able to then address those issues. I want to reinforce that even though we've added numerous staff and funding, we do still have a very big capacity issue. And that with more people being identified and assessed, there's only been 17% of people who were assessed that were placed into a housing program. If you do run across someone out in the community that are homeless, you can reach out to our outreach team by email at councilforthehomeless.org or through our hotline phone. And either myself or my program manager will get back to you and get that information so that we can reach out to those folks. And I'm putting that in the chat. And another thing that I also would like to add is we've actually really seen a big increase in senior populations. Seniors are really starting to experience a lot of homelessness. So we do work with, if we can't get folks in an apartment, helping them to get rooms for rent. We pay past due property debt. We can help with past due utilities, some car repairs so that folks can continue to be self-sufficient and get to the appointments that they need to. Once they are housed, we're able to connect them to other resources in the community like the furniture bank so that they can get a home, get their place completely furnished. And the number of senior individuals that we had experiencing houselessness in 2021 was 739. So that's a significant number. And I believe that was all that I had to share. Sorry, it's so short.
No, that's great. Thanks, Claire. And thanks for pointing that out about seniors. And I think that speaks directly to people on fixed incomes and the rising rents that we have seen over the last several years. So thank you for that information. I'm going to go back to sharing my screen here. Just bear with me. Because next, I would like to introduce Sunny Wonder. Sunny is the Deputy Director for Council for the Homeless, and she is here to talk about the 2021 data for rental assistance. You are going to find what became a very big part of what we did here in Clark County in 2020 and 2021. And also she's going to talk about the program called Diversion, which is one-time financial assistance and coaching for folks, again, folks on that low end of the spectrum of need. And also she'll talk about families experiencing homelessness and youth experiencing homelessness. So Sunny, I will turn it over to you.
Hello, thank you, Laura, and good evening, everyone. So rental assistance, I think it really has been touched, folks have touched on it a lot already. My colleagues have touched on it this evening. This has, 2020 and 2021, we saw, I think unprecedented is a word that has been used a lot, but truly was unprecedented amount of need. The numbers that we have seen that were served in, so talking about 2021 specifically, the number of households that were served, 4,785 households were served with rental assistance in 2021. And I really want to highlight that that is double the number of folks that were served in 2020. So the amount of money that was coming from the federal, from the state, as well as from the Treasury Department, from the federal level. There's a lot of funds that came into the community, and a big shift is a community to get geared up to spend a significant amount of money to keep folks stabilized. When we're looking at the numbers from 2021, I think that it's really important to keep in mind that this funding was a huge impact, as well as the eviction moratorium that was in place that started in 2020 and went through to ending in August of 2021. And then there was the bridge proclamation that extended, kept folks continuing to be housed for through October. So just want to put that additional context in mind that a lot of the numbers that you are seeing in the report are going to be impacted by the amount of rental assistance that has been in our community, as well as the eviction moratorium. Something that a real positive, 98% of the households who received rental assistance did not re-enter our homeless crisis response system in 2020 to 2021. So just keeping in mind with the amount of need that we were seeing of those folks that received assistance, they were not re-accessing the system because they had split the homelessness. So all of those factors, the amount of rental assistance, the eviction moratorium, most definitely played a part. But a very small number of folks that were slipping into homelessness, which is absolutely an incredible success. Next slide. So as Laura mentioned and Shabana mentioned as well, diversion or coaching assistance. So again, just as a reminder, is one-time financial assistance to stabilize someone in housing or get them quickly moved back into housing, connection to resources and coaching. So navigating supports. This is for folks who perhaps have lots of stuff that they're navigating through, lots of vulnerabilities, but keeping in mind that they're able to continue, they're able to pay their own rent. So they're just needing that one-time assistance. With the numbers that we saw in 2021, we actually saw a marked decrease in households accessing this resource. So just across the board, 2020 and 2021, a significant reduction. So you can see those numbers and it is significant. So 374 households were served in 2019 with this service. 171 in 2020 and 143 in 2021. I think that it is really important to think about what Shabana was talking about around impacts for, has often been an avenue that our communities of color are accessing at much higher rates, and how that might tie into the numbers and the reduction in folks that are accessing this service. A big piece of it is recognizing that employment was very, very unpredictable. I talked to a lot of youth and definitely talked to a lot of families that were choosing to remain in their housing situation, whether it was a situation that whether they were housed or staying in their car, they were choosing to stay there because they did not feel and did not want to risk eviction getting moved in. Like, I have a job today and I don't know what's going to happen. So just that fear was preventing folks from moving forward with this resource. Next slide. And then just touching briefly on trends with youth and families. With youth experiencing homelessness and housing instability, the numbers remained pretty steady from 2020 to 2021. We did see a decrease in youth accessing shelter, but it did also see an increase in youth that were being referred to programs, housing programs that were moving youth from homelessness into housing. And then with families, we did see a decrease in requests for shelter, which most definitely tracks. It makes sense that there would be an impact on folks that felt comfortable due to impacts of COVID-19. I think that is going to continue to be a common theme as we reflect over the past couple of years. That COVID impacted a lot of things, and folks most definitely, particularly thinking of congregate shelter where folks were in a shared space, that was something that felt particularly unsafe. And then calling out, which I mentioned before, but fewer Black, Indigenous, and people of color that were accessing diversion services as well. And that's what I have. Back to you, Laura.
Great. Thank you so much, Sunny. Just really good information. And again, speaking to, you know, the fact that so many people were served and homelessness was prevented by that rental assistance. It really does go back to, it's about the rent. It's about the cost of living. You know, people always ask, why is homelessness so bad? I think that's pretty revealing as to why, as how successful that's been. So last but definitely not least tonight, I would like to introduce Melissa Baker, the Council for the Homeless Coordinated Entry Director. Coordinated Entry is the one-stop approach for people who are experiencing homelessness. And Melissa oversees the operation of the Housing Solutions Center, the Housing Hotline, and the by name list of folks experiencing homelessness, like veterans and people who are chronically homeless and seniors, among many other incredible things at Council for the Homeless that she does. But tonight she's here to talk about data from 2021 regarding coordinated entry and also veterans and seniors. So Melissa, I will turn it over to you.
All right, thank you. Yeah, so I'd like to just talk briefly about, like Laura mentioned, veterans and seniors as it relates to last year's system numbers. I'm going to try to provide a little bit of context and not take up too much of your time this evening. So 2021 was a really exciting year for our homeless crisis response system. We have been using by name list coalitions for several years. And what that is a group of providers who sit at the same table that provide services for folks experiencing homelessness. And they know every person that's experiencing homelessness by name, what their barriers are, what they need to have happen, and what supports that they need provided to help them end their homelessness crisis. And what was really great in 2021 is that we were able to partner with Community Solutions Built for Zero initiative, which it gave us a whole bunch of tools and best practices to really fine stream and hone in on these very effective coalition groups. So veterans are one of the two populations that we focus on in these coalitions. And again, these are system-wide coalitions led by Council for the Homeless, but partners across multiple agencies and different systems of care like behavioral health, substance use disorders agencies are at the table for these meetings. So like I mentioned, we analyze real-time data and we collaborate on solutions for each, in this case, veteran on the by name list. And that has been an integral part in our ability as a community to serve veterans experiencing homelessness. And so as you can see in those numbers, in general, there was a decrease in a lot of the areas for veterans, or a maintenance of the percentage. So these tools from Built for Zero help the by name coalition service providers more effectively serve veterans experiencing homelessness. And in addition to the Built for Zero initiative, another thing that we did in 2021 and continued to do from previous years' efforts is strengthening partnerships with other veteran service providers. And we were able to find new ways to connect veterans experiencing homelessness to the VA or the Veteran Affairs, and also civilian programming and civilian supports as well. While in many communities, veteran and non-veteran programming operates in silos, our community saw an increase in the integration of program delivery and coordination of services. An example that I wanted to provide that illustrates the effectiveness of these by name list coalitions. I'm going to call this client Richard. And so it was really wonderful. We received feedback from one of our outreach providers last year about Richard. Richard had been experiencing homelessness in Clark County for over a decade. Long ago, he lost trust in our system. Long ago, he had been promised and repromised, and he wasn't getting housed. His crisis wasn't ending, and so he was done. After we had been utilizing the by name list coalitions, it made it so that we had the collaborative ability to reach out to Richard repeatedly. One thing that I think Clara mentioned is that on average, it takes about 17 attempts to create relationship and build trust, again, on average. And because of the collaboration of these by name list coalitions, we were able to do that. And Richard finally said, I'll try again. And he got housed. So it was because of the efforts of our community outreach, of our service providers, and our collaboration, where the veteran in this situation was able to be housed and be served appropriately. In addition, and a little bit in addition to the homeless crisis response system, like literal homelessness efforts, the Veterans Assistance Center, which is a nonprofit that serves veterans in Clark County, also provided rental assistance with emergency COVID dollars. And similar to what Sunny reported, the number that they were serving with prevention assistance or emergency COVID dollars in general, it doubled from 2020 to 2021. So that was another dramatic increase that's reflected in those numbers that you see on that report. And then I'd like to touch base a little bit on seniors. So Clara did a great job mentioning that the increase of senior homelessness over the past several years has been a dramatic increase. And Laura had mentioned how oftentimes it's because fixed income and rapidly rising rental costs and just can't keep up. And so a lot of seniors, a surprising amount that were the 65, 70 and older seniors were falling into homelessness. And so before the pandemic hit, this was a truth, and it continued to be true during the pandemic. Though what we're grateful for is that based on these system numbers, you can see that there was a slight decrease from 2020 to 2021. And also reflected in the report is that you can see housing placements for seniors dramatically increased. And so this reflects that seniors have become a priority in a priority population in an effort to shelter and house our most vulnerable citizens. Many programs in our system have focused in the past year on folks that are 55 and older, especially in the programs that provide longer term rental assistance, which is called permanent supportive housing. And that is for the most vulnerable in our community that receive that. Also, what you can see in that report is that we are seeing an increase in seniors accessing shelter, and that is likely to due to an increase in some senior focused shelter beds that opened up in 2021 near the end of the year, and has allowed us to continue to increase our capacity to serve seniors that are outside and experiencing homelessness. Emergency COVID rental assistance funds and the eviction moratorium also prevented seniors from falling into homelessness in 2021. In fact, both veterans and seniors saw an increase in receiving rental assistance, and that also correlates to the reduction for both groups in experiencing homelessness at any point in 2021, which is, it's good to see. That's part of the good news that Laura started us with. And that is what I have. Thank you.
All right, thank you so much, Melissa. Okay, well, I'm just going to move us right along here, and we're going to wrap up our time together. Again, I just want to thank this incredible panel of speakers tonight. And, think about, oftentimes, people ask us why homelessness is increasing in our community, despite the efforts you've heard about here tonight, right? And this question may have even been what motivated you to attend this webinar tonight. But analyzing the numbers from 2021 shows the complexity and nuance involved in answering this question. With all that we discussed tonight, there are two main trends that at first may appear to contradict one another, but taken together, they highlight the effect the pandemic and the response to it have had on homelessness. The bottom line, while the number of households experiencing homelessness did increase by 1.6% from 2020 to 2021, the number of people new to homelessness fell by 8%. And behind those percentages, I just want to remind everyone, are individuals and families, and they are our neighbors. So I hope after tonight that you can see that homelessness is both complicated and solvable. each day it's being solved for individuals and families. And we understand that people in the community may not be able to see the 650 plus households each year that are being housed, but good work is being done. We simply need to be able to do more of it. So when you think about the numbers, remember only 17% of people who requested housing services received it. Know that people do not choose to be homeless when it comes down to it, even if they tell you that they are choosing it. You know, a lot of times that's a defense mechanism. That's part of that lack of trust that you encounter with folks in the beginning. And it does take time to build trust to get people safely and stably housed. You know, they're experiencing trauma when they're living on the streets and when they don't have a safe, stable, reliable place to sleep at night. And since there's no one size fits all approach to homelessness solutions, the system is required to meet people where they are and to be nimble and compassionate. And so I just want to leave tonight with some calls to action and how to help. You can help by advocating for coordination across services and systems, because that's how we bring the most resources to end homelessness on an individual and a community level. You've heard a lot tonight about how Council for the Homeless coordinates across the community, anything from data entry into HMIS to coordinated outreach to coordinated entry. All of it is coordinated across the services and the continuum of care and the spectrum of need that's out there. Hopefully tonight you've seen just how interconnected it all is. Council for the Homeless also invites people who care about homelessness into this community of service providers. If your community group or faith community that you're a part of wants to engage in solutions to homelessness, let us know. A lot of the services that are provided are done on a grassroots level, and it's all important. Donate your time and money to the organizations that are listed in that system numbers report that you are looking at tonight. They each bring a piece of the puzzle to overall solutions and need your support. And donating to a group or an agency is a good way to leverage your dollars and make them go farther. And if fundraisers are your thing, and we do have some fun at our fundraisers, trust me, you can save the date and plan to attend the Council for the Homeless annual fundraising and education luncheon. It's going to be October 20th at noon, and it's free to attend, although you know we will be asking for financial gifts. But the luncheon is virtual again this year due just to the unpredictability of COVID-19. But this year's luncheon features Greg Colburn from the University of Washington. He is an expert in the areas of housing policy, housing markets, affordable housing, and homelessness. And he is the author of Homelessness is a Housing Problem. Really interesting book if you get a chance to check it out. And as always, educate, let people know what you've learned here tonight. Share the data, dispel the myths, and reduce the stigmas of homelessness. And last but not least, as I always say, be kind. It makes a world of difference and it goes a long way. So thank you so much for attending tonight, and we will see you next time. Take care, everybody. Bye-bye.